Are you thinking of studying dentistry in Nigeria? Then get ready for a very exciting, rewarding and challenging journey from your basic medical sciences through to your clinical years to hands-on patient care. In this video, I'm going to tell you all you need to know about studying dentistry in Nigeria, your basic requirements, what you need to do in your preclinical years and your clinical years. And if that's something that interests you, make sure you keep watching this video to the end. Subscribe to my YouTube channel and put on the notification bell so you get more notifications when I post more videos. Now let's get into the video. Hi guys, welcome back to Dolapo's Diaries. My name is Dolapo and I'm your host for this channel. I'm a 500 level dental student living in Nigeria. I create content about dentistry, beauty and lifestyle, and today we're going to talk about what you need to know about studying dentistry in Nigeria. There's not much content about studying dentistry in Nigeria, and I think this is partly due to the fact that there are not many dentists in Nigeria to begin with. If this is the kind of information you've been wanting to hear, make sure you share this video with others too, because I'm sure there are many other people, especially young people, that are trying to make life choices about their university courses and are confused, and this video can really help them and guide them into making the best decision. Dentistry is a medical course that deals with the study of teeth and its other related structures. That is just a very watered down definition. But yeah, we study about the teeth, the diseases of the teeth, and also of its other related structures like the gums, the tongue, your throat, and other specialties even go as far as looking into your head and your neck. So there are many specialties in dentistry. And that is one common misconception. Everybody just thinks when you talk about dentistry, you mean just go there and they start removing people's teeth. It goes further than that. There are many subspecialties, and there are even newer subspecialties that are springing up. So the common ones is number one, the oral and maxillofacial surgery. These people are surgeons. You can get that from the name. They deal with the head and neck structures, so they usually work hand in hand with the neurosurgeons, sometimes with the ear, nose and throat surgeon. They actually know a lot of medicine, and for them to be bosses in their specialties, they actually do a lot of reading, and they are extensive dentists, so they are up there. We also have orthodontics. This is a specialty that deals with malocclusions, misalignment of your teeth. They want to help your teeth look better. They are the ones that will give you braces, removable appliances, etc. I have pediatrics. From the name pediatrics, they deal with teeth of children. Simple. But they do everything as long as it relates to teeth of a child under 18. We also have prosthodontics. They are the ones that will fabricate dentures for you. We have the conservative dentistry, periodontologists. They deal with your gum health. They give you scaling and polishing if you have much plaque and calculus accumulation. Also other subspecialties like oral medicine, which is a relatively new subspecialty. It is not thoroughly developed in Nigeria. In conclusion, there are many subspecialties in dentistry. There are many things you can do as a dentist. You're not just limited to extracting teeth. So if you want to study dentistry in Nigeria, one of the first things you need to know is that you need to know that this course is 6 years. It's not 5 years, it is not 7 years. Some people think dentistry is 5 years. I don't know why. Well, maybe because they're not well informed. It takes the same amount of years as medicine. Now, these years are structured in different ways according to different schools. If you want to study dentistry in Nigeria, the chances are high that you would study in a public university. I can't think of any private university off the top of my head that offers dentistry. If there is, it is new, and if there is and you know, please drop it in the comment section so that we can educate people together. So in public universities, there are different structures for different schools. I'm going to talk about the structure in my school. I attend Obafemi Awolowo University. You are going to go over your basic science courses. So that is your biology, although it's not going to be biology now, it's going to be botany and zoology, and your physics and your chemistry, along with other courses. So you're going to do these courses again because you have to prove to the university that you actually know these courses and you were not, passed from JAMB and WAEC. In my school, if you don't pass these courses, if you fail any of these courses, you are not going to go to 200 level. Unlike other departments, that if you fail a course, you're just going to have a carryover. It doesn't work like that for dentistry and also medicine. The pass mark is 40 for part 1. You are not going to join 200 level, so you're going to stay back and take that course again. So it's very important that you know this, because a lot of people don't know this, and then they have problems in that first year and it demoralizes them for the rest of the journey. 200 level, you're going to take anatomy, physiology, and biochemistry courses. Same for 300 level, but in my school, you write an MB. We call an MB a professional medical board exam. So M for medical, B for board, E for exam, but we shorten it to MB. So you write an MB at the end of your 200 level and at the end of your 300 level. I've learned that in other schools, it is not like that. Some just write one MB at the end of 300 level. Others squeeze 200 and 300 level into a class or into like a certain amount of months instead of like 2 long classes. In my school, you're going to write 2 MBs, one in part 2 and one in part 3. The rule that applied for the first level also applies there. Like if you fail 1 out of the 3, like let's say you have a problem in anatomy, you are going to resit anatomy. You are going to stay back during the break that they give you and you are going to write the exam again, and if you pass it, you go to the next class. If you fail it, you have to repeat the class. If you fail 2 out of the 3 courses at the end of your MB, you're going to repeat the class. There's no 2 ways about it. And if you fail all 3, you are going to be withdrawn from College of Health Sciences, from dentistry. So that's how the structure is in my school. In other schools, it is quite different. If you fail all 3 courses in some other schools, they may allow you to resit. Some will allow you to resit 2, but it's different in Obafemi Awolowo University. You're only allowed to resit 1. I think I'm going to make separate videos about exams in medical school and how to prepare for your exams, because the way the exams are structured, you need to read, and you need to read well. So moving on to 400 level, notice how I've not mentioned any dental course yet. Even though you've applied for dentistry, you still not started studying any dental course in your 300 level, because that's how the structure is in my school, right? So in your 400 level, we call this class the Path and Pharm class. Path for pathology, Pharm for pharmacology. Pathology is subdivided into 4 major courses, while pathology stands alone. And aside from this, you're going to start your clinical rotation. So this is the beginning of the clinical class. As a little reminder, you're going to be with your medical counterparts all through these years, from your year 1, 2, 3, and 4. You're going to be with them. In my school, that's how it is. So your 400 level, you're going to rotate clinics, medical clinics, surgery clinics. You're going to go to hematology postings, practical work, chemical pathology. All of these things may sound foreign to you if you're not yet in the game, but trust me, all it takes is just a number of years. This class comes with its own challenges, because you go to classes 8 to 4, sometimes 5 every day. You write multiple in courses. You still have to write EOPs. EOPs are end of posting exams. So for each posting you are doing, you are writing exam for that posting at the end of that posting, and you are still writing exams for class. You are going to classes, reading your books, you are reading what they're teaching in clinics. So it gets very tough at this stage. A lot of people are tired at the end of the day. Some people want to give up and not study dentistry anymore. So this class is very tasking. So at the end of this class, you write another professional exam, and if you pass, congratulations, you have finally made it into the dental floor. Obafemi Awolowo University 500 level marks the beginning of studying dentistry. And this does not mean that every other thing you've done is for waste. No. Because as a dentist, you are still going to be a doctor. So all of those things you've done from your year 1 to your year 4, they are foundational things that you must not forget if you want to be a good doctor. In my school, 500 level is split into 2. We have the pre-phase class and the post-phase class. We'll just call it that, just to have a distinction. In the pre-phase, we study subjects like oral anatomy, oral physiology, dental biomaterial science, prosthodontics, and operative techniques in dentistry. These courses used to be part of the preclinical classes, that's the 200 level and the 300 level. They revised the outline, and now it is a 500 level course that we take. In other schools, this is actually part of their 200, 300 level. Some other schools even do this in 400 level because of how their own structure is. You also have practical dental classes. So this is the class where you learn how to make a model, you learn how to treat cavities, but we're not using patients, right? We're using models. So we're drilling onto like fake teeth, we are waxing up dentures, we are fabricating dentures just on models. Now, at the end of that, you also write another professional medical board exam, and if you pass, you are now in post-phase dentistry. In post-phase dentistry, you are entirely in the clinics. You go to classes in the morning. Is the schedule also for 8 to 5, so you have a morning class which spans usually from 8 to 10, after which you go to the clinic from 10 to 5. Post-phase, we start taking subjects like oral medicine, orthodontics, pedodontics, oral pathology, oral radiology, Our class is split into different groups, 4 groups, and then we rotate each postings at different times. We complete our rotations and then we write our medical board exam. Currently, I'm rounding up 500 level. We're going to have our medical board exams by February, and this is December. So I am in my penultimate posting till we round up the entire rotation. So 600 levels soon. When I pass my exams, I'm going to move on to 600 level, and there are also rotations that continue 600 level. So 500 level and 600 level share a similar pattern. You are still in the clinics, you take your classes, and then you go to the clinics and you have your rotations. So we do surgery rotations, conservative dentistry rotation, community dentistry, periodontology. Those are the 600 level courses that we battle. Like I've been saying, this may be different in another public university. In 500 level and 600 level, you have requirements that you have to tick before you become a doctor or before you're even allowed to write your exam. And this is because studying dentistry not only requires your brain, it requires your hands. So you have to be a hands-on doctor. Even as a student, you have to have worked on patients. So there's a minimum amount of patients you must have treated, done certain procedures for, clerked, interacted with in the clinic, and have a logbook that you document all of these things in. So this is why dentistry sometimes can be very tasking, because aside from the bulk of schoolwork you have to read and go through, you also have to have ticked your requirements. At the end of all of this studying, and then you pass the 600 level, you satisfy your examiners, you are finally allowed to go into the world and be a dentist. And this is very exciting. I'm looking forward to it. So by now you have a very strong idea of how studying dentistry in Nigeria goes and what the breakdown is like. Now, what are the advantages of studying dentistry in Nigeria? Why should you study dentistry? Number one, as a dentist, you have a slightly more flexible time. Most clinics run from 8 to 4, 5 most times, and most specialties don't really require you to go for calls to see patients on the weekend, except if you are going to specialties like oral and maxillofacial surgery, where you're a surgeon and you can be called anytime to come and attend to your patients. So dentistry has the advantage of a slightly more flexible working time. Number two, studying dentistry is very interesting. It is very practical. It is very hands-on. As a 500 level student, I've attended to patients, I've treated patients, well, under the supervision of my consultants. Another advantage of studying dentistry in Nigeria is that it is easier to start a private practice. Although this is very controversial, because some people will argue that it is not. It is quite easy to start a private practice because you have your knowledge, you have your hand skills, you can treat patients, and after maybe your house job, you can decide to go into private practice if you have the funding, and nobody's going to stop you. One of the disadvantages, or let me say inconveniences, about studying dentistry is, number one, the amount of years. Even though studying dentistry takes 6 years, those 6 years are going to look like 10 years. And if you're studying dentistry in a public uni, best believe those 6 years are going to be elongated by a certain number of months. Using myself as an example, I am in 500 level, but this is my 7th year in the university. There was ASU strike and there was COVID strike and all of those things. So if you are planning to study a medical course or even any course in a public uni in Nigeria, just, do yourself a favor and add 1 or 2 years, because it can happen. In conclusion, studying dentistry can be hard, it can be exciting, it can be annoying, it can be rewarding, from however lens you choose to view it. But it is important for you to know the nitty-gritties and the details of whatever course it is you are going to study in the university, so that you would shape your expectations, you would know what to do and how to go about some things. Going in the university with little to no knowledge of the course you want to study can be very disadvantageous, because you are going in blind and you may have very high expectations that may be cut short early, and then you may lose interest in your course of study. So that is why I made this video, because there is not much information out there about what to know before you become a dental student in Nigeria. I hope this video encourages you rather than discourages you to study dentistry in Nigeria, because trust me, we need more dentists. If you enjoyed this video, please subscribe to my channel, like and share this video with anybody that you think needs it, anybody studying dentistry in the university, anybody that wants to study dentistry in university. If you're studying dentistry from another school and there are interesting things you want to share, please don't hesitate to share them in the comments. I want to know what your experience of studying dentistry is, and I want to see how different it is from ours. If you watched this video thus far, thank you, I love you, and I'll see you guys in my next video. Bye bye. Dental physiology. In my school, but they revised the waxing up, antics. No, let's not do that. Let's not. I hope this video serves as an encouragement rather than a